Hello and welcome to the Michigan Fitness Foundation topic tasting. Today we will be talking about aligning interventions with audience needs. Before I jump into tips on how you can choose interventions aligned with audience needs, I'll take a moment to discuss why we are talking about this. Aligning interventions to meet an identified audience's needs is a key step in program planning. Your organization did a needs assessment to ensure that your SNAP-Ed program's direct nutrition education, physical activity promotion, and policy systems and environmental change initiatives meet the needs of the SNAP-eligible participants you plan to reach, and likely has done a needs assessment for any grant funding opportunity. Doing a needs assessment also helps to build the case for why you plan to work with a specific population and why the interventions you planned would meet the population's needs. If you have been involved in conducting a needs assessment for SNAP-Ed programs or for other programs, you may have found that gathering relevant data for your community was challenging because the data available didn't cover your geographic area or there weren't data for specific demographic groups. You may have been surprised by a point of data about your community. You may have seen something in the data that changed what you plan to do in the program. You might have discovered a need, but also discovered that there wasn't a clear choice for an evidence-based intervention to address that need, or you may have been overwhelmed by the needs that you saw. Certainly conducting a needs assessment can be very informative, and we have limited resources and a lot of need. We can't do everything. For example, even looking at needs broadly among Michigan adults and teens, we know that fruit and vegetable intake remains below recommendations for health. 1 in 4 adults in Michigan ate vegetables less than once a day, and 2 in 5 ate fruits less than once a day. And among high schoolers, nearly 2 in 5 ate fruits, and also nearly 2 in 5 ate vegetables less than once a day. We see the same for physical activity, which also remains below recommendations for health. Only 1 in 5 adults had adequate physical activity, and 1 in 4 had no leisure time physical activity. And less than 1 in 4 Michigan high schoolers participated in at least 1 hour of moderate or vigorous physical activity daily. We also know that nearly 1 in 7 Michigan residents participate in SNAP, which in 2015 was about 1.5 million people. Of course, Michigan is a diverse state with diverse communities. Needs will vary by age group, ability, culture, geography, and other factors, such as gender, employment status, housing, language, transportation, and mobility needs, education, family composition, and so on. So, since we can't do everything for everyone, we prioritize, and one of the ways we do this is by finding and serving the unmet needs of our audience. And remember, needs will change over time, perhaps because of changes in your community or audience, or perhaps because programs that you have been doing have addressed some needs by creating sustainable changes so that you can move to the next or a new identified need. So now on to some tips on how to align interventions with audience needs. What I'll present isn't an exhaustive list, but it is a place to start. So first, define your goal. You want to consider, does your goal address needs identified in your needs assessment? And have you prioritized needs from your needs assessment so that you have a clear and actionable goal? Remember that in Michigan, our SNAP-Ed goals are to increase fruit and vegetable consumption and increase physical activity. Next, explore interventions. Take a look at what interventions are available to you to meet your goals. The SNAP-Ed Toolkit is a great resource for evidence-based, research and practice-tested, and emerging interventions. But just because an intervention is in the toolkit does not mean it's a good fit for your audience. Next, you can consider expected outcomes. Think about whether the intervention has been shown to produce the outcomes you're expecting. By how much? Be concrete and look at the numbers. Also think about whether the intervention has been shown to be effective for a population like yours, and think about whether the intervention has been shown to be effective in settings like yours. So consider both the people you are serving and the settings you are serving them in. You should also consider your organization. Some things to think about are, does the intervention align with your organization's mission? Will your organization have the capacity to adequately support the intervention? Or can you reasonably build that capacity? Does the intervention timeline make sense for your organization? And has your organization used the intervention before? And if so, what did you learn? You should also consider your community. Just because something works for your organization doesn't mean it will work for your community. So think about what else is happening in your community and what that might mean for your plans. And also think about whether your community is ready for that change. And consider the people involved. Ask, is the intervention culturally appropriate for your target audience? And does the intervention address participant feedback that you have received? Also, are decision makers on board, or can you get them on board to make your plans happen? And finally, pick the best interventions. When it comes to picking the best interventions, a great way to make sure you've fully thought through these considerations is to draw it out and double check to see that it makes sense. So first you can think about what you have, your target audience and their needs, as well as your organizational resources and your community resources. Then think about what it is that you plan to do, including both your direct education and policy systems and environmental change interventions, remembering the evidence base for those interventions. And think about what you plan to achieve, the change that you will see in people's lives. And look at this as a whole. Do you have what you need to make the planned interventions happen? Do the direct education and PSE interventions reinforce each other? That your direct education and PSE work should work in tandem to achieve the outcomes you're expecting? And can you reasonably expect that your program will address the identified needs and lead to the desired outcomes? Thank you, and if you have any questions, please contact your local project lead or your MFF SNAP-Ed project manager.